I'm the first member of our public health track, and I'm very excited about it. I sort of became interested in rural medicine. I have a lot of family scattered throughout Wisconsin, some in more rural areas than others. I grew up in Stevens Point, but through my medical training and then just kind of through knowing folks around Wisconsin, I really saw that there's a huge shortage of mental health providers. For example, I was doing a rotation up in Minocqua, Wisconsin, and there were folks from Wausau, which is a much larger town. Minocqua is a small tourist town which expands in the summer, but in the winter it's quite small. And there were folks driving from Wausau up to Minocqua to get psych care, so 2 hours north from this large area where they couldn't find anybody to take their insurance to this smaller area. And so, during medical school, I did a lot of rural rotations, and I saw a lot of this, especially with children and with the elderly. During medical school, I was a clinic coordinator at one of our mental health free clinics called Safe Haven, and that experience really kind of pushed me towards psychiatry, kind of solidified that plan. I came into medical school, knowing I wanted to do something in the realm of primary care. I do consider psychiatry to be primary care, but that experience at Safe Haven, first of all, working with folks with severe and persistent mental illness, which was kind of the focus of the clinic. I just saw mental illness throughout the life cycle and the issue of homelessness in Madison. Homelessness and mental illness is huge in this country. And so it just really, that's why I went into psychiatry, that experience specifically. I went to medical school here at UW, and I had a chance to do a number of psych electives during my medical training. As I said, I was clinic coordinator at Safe Haven and got to work with a lot of faculty there. And the number one thing that drew me to UW-Madison is the people. I really loved working with every single faculty member, every single resident that I worked with. Everybody had a unique and different perspective, and I just really appreciated seeing that and getting to know everyone. And so the people is number one what drew me here. But the public health track's kind of like a little bonus. I was definitely, I looked at other programs with kind of rural experiences, and there was nothing quite like the public health track. As my very first rotation as part of the public health track, I did an ambulatory medicine, outpatient family medicine rotation in Lancaster, Wisconsin, which is a town kind of west of Dodgeville, slightly northwest of Platteville, a town of about 6,000 folks. And it was the full family medicine experience, like real world family medicine. There was OB, there was emergency room experience, there were procedures, and really caring for the entire age range throughout the life cycle. And so I just really loved that experience. I had a wonderful time working with the docs there, Dr. Stater and Dr. Varnum, and it was definitely a highlight of my first year, I would have to say, other than the psychiatry parts. As part of the public health track, there's that one rotation in the first year where you get to do outpatient family medicine, which is wonderful. In the second year, I'll get to do some telepsychiatry at the VA. Which I'm very excited about. I'll get to be seeing folks all the way up in Iron Mountain, Michigan at their VA, and helping them out from here in Madison. So I think that's one of the futures of mental health care, telepsychiatry definitely. As a third and fourth year, I'll get to do more rotations throughout the state. So I'll get to go to Baraboo. I'm hoping to do a rotation up in Ashland Bayfield at a small inpatient psychiatric unit, and then they also have outpatient services there. I will get to go to Viroqua to our mental health cooperative, in an area that serves a lot of Amish and Mennonite families. So in general, what I'm hoping to learn is how to practice in a rural area, and also how different healthcare systems are working to meet the mental health needs of their populations. And I think, one of the futures of psychiatry, as I said, telepsychiatry and integrated care. And I'm just very interested in seeing how different models are, used throughout the state. As part of this public health track, ultimately what I'm really interested in contributing to is expanding access to mental health care throughout the state of Wisconsin. I'm Wisconsin born and raised, and plan on staying in the state, or at least the Midwest. And so in terms of expanding access to mental health care throughout the state, I think that this track will prepare me to consult with other healthcare systems and determine how best to reach their populations. Whether that's all of northern Wisconsin or a smaller area of the state. I think that the future of mental health care, we're just not going to have enough providers. And I think telepsychiatry, first of all, and then integrated care are wonderful directions that mental health care is moving in. And certainly one of the things that drew me to psychiatry is the collaborative nature of care. So I think we need to focus more on team-based care, expanding our networks to include, both psychiatry, psychology, all of the other various practitioners who do psychotherapy, case management services, social work. Really mental health care works best when it's done in a team-based environment. So I'm very excited about the future of mental health in this state, and I think we've got a long way to go, but I'm looking forward to being part of it.